The area being assessed here is the elbow, wrist and hand. The safe setup for this is to ensure the client is comfortably seated whilst doing the movements, and that throughout the practitioner clearly communicates with the client about the movements that they're going to be doing. The movement at the elbow, wrist and hand are pronation, supination, radial and order, deviation, flexion, extension. Movement at the elbow, flexion, extension, pronation, supination. Movements at the wrist, flexion, extension, ulnar deviation and radial deviation. Active elbow flexion. Place hands facing in front with arm by your side and bring the hands up to touch your shoulder. Passive elbow flexion. Relax the patient and take the full weight of the arm by placing one hand just above the elbow and the other hand on the wrist. And take the arm from extension all the way into flexion and bring the hand to the shoulder. Resisted elbow flexion. Practitioner places one hand on the wrist and the other hand on the bicep and is resisting against the client who is trying to bring their hand up towards the shoulder by pushing downwards. During this movement, it is important for the practitioner to look at the patient's face, and this is so that they can see whether the patient is in any pain or discomfort when resisted. Elbow extension. From the flexed position where the hands are placed onto the shoulder, the client now needs to bring the arm back down and bring them back to the centre as far as they can. Passive extension. There is very limited movement here, and to passively move the elbow into extension, the practitioner must put their arm in neutral position and then bring the arm backwards. Resisted elbow extension. Place one hand on the front of the wrist and the other hand above the elbow and instruct the clients to push back towards you as hard as they can and don't let the practitioner move them. Active pronation. The patient brings the arm into mid position and then move their thumbs down so that they are towards the floor. Passive pronation. The client arm is placed in mid position and practitioner is holding the elbow whilst the other hand is shaking the client's hand and bring the elbow into pronation by bringing the hand and thumb downwards. Resisted pronation. Practitioner positions hand in a handshake position with the client and other hand is placed on the elbow for support. The client's arm is placed in mid position once again and the practitioner is pushing against the client who is trying to push their hand downwards towards the floor by pushing upwards and turning the practitioner's hand. Active supination. The patient's arm will be placed into the mid position, but the hands are facing upwards as if the patient is carrying something. Passive supination. The client's arm is again placed in the mid position, and one of the practitioner's hands must be placed in the hand of the client as if they are handshaking, and the other hand is assisting the elbow. The practitioner then needs to bring the hand so that the palm is facing the ceiling. Resisted supination. Once the hand is in a pronated position, the practitioner now places the hand on top of the fingers and push down against the arm, and the client is pushing up to turn the hand into supination position. The movement of wrist and hand. The movements are wrist flexion, wrist extension, ulnar deviation and radial deviation. Active wrist flexion. The client needs to bring the fingertips up towards the ceiling. Passive wrist flexion. Practitioner places one hand on top of the client's hand and bring the fingers up towards the ceiling whilst the other hand is placed on the wrist. Isotonic contraction for resisted wrist flexion. The client needs to resist the practitioner who placed their hand on top of the fingers and bring their fingertips up towards the ceiling. Active wrist extension. Turn the hands over so that the palms are placed down and bring the fingers and wrist up towards the ceiling. Passive wrist extension. Turn the client's hand over so that the palms are on the table and the practitioner then places their hand on the client and bring their finger upwards towards the ceiling. Resisted wrist extension. The palms of the patients are on the couch and the practitioners then place their hands on top of the hand and fingers and pushes downwards against the patient who is resisting and bringing their fingers towards the ceiling. Active ulnar deviation. This is where they bring their hands towards each other. Passive ulnar deviation. Continue to hold the hand in the same position as done for the passive wrist extension and bring the hand inwards towards the other hand. Resisted ulnar deviation. The client is pushing inwards towards the other hand and resisting the practitioner who is trying to push their hand in the opposite direction by placing both hands on top of the client's mid-hand and fingers. Active radial deviation. Bring the thumbs away from each other passive radial deviation. Once again, the hand position is the same as when doing an all-wheel deviation. However, this time the practitioner has moved the client's thumb away from each other. Resisted radial deviation. The client has hands facing upwards and pushing outwards, whilst the practitioner is pushing away the client and going inwards by placing their hand on top of the client. The functional test for the Alber-Risson hand is the hand grip dynamometer.